testing is an issue, vaccine take-up is an issue. Do you think we're headed for some kind of restriction?
I think it's quite possible. I think here in California, for instance, an indoor mask mandate has been put into place for 1 month between mid-December to mid-January to try and get through the teeth of the crisis. I don't know that we're going to get shelter-in-place orders again or close businesses. Some of the businesses are having a hard time getting people to work for them because there's so much, because of the spread of the virus. So that might have some impact as well, kind of a secondary impact. But I don't see us going to widespread shelter-in-place orders. Yes.
Doctor, how comparable is what is happening here where I am in the UK and what is happening where you are in the United States?
Well, I think we draw that analogy at our peril because the British chose to vaccinate largely with AstraZeneca vaccine initially, and now are trying this mad dash for Pfizer boosters, which is, and I think that's basically the only thing you can do is to have a mad dash for Pfizer boosters, but it's just not, the timing's off by about a month. And it's nobody's fault. It just is. So I don't know that it's totally analogous. I think you guys are taking one right now, and it gives us a lead time to get things into place. I'd also add to the list of things that need to get done is that we need to have lots more capacity to deliver booster doses. It's not an unavailability of vaccine. It's an unavailability of people to deliver them. So, and I think we're going to start seeing National Guard kind of solutions. Yeah.
Okay, but this goes to the point, I think, of what I've been reading about over the last few days. Obviously, I live in New York, so I'm completely biased on that front. But the idea that New York seemed to be very well vaccinated. New York seemed to be, in some respects, pretty well boosted. Either I'm wrong in that, or somehow it doesn't really make a difference. And I'm just trying to understand why the spread seems so concentrated in New York versus other high-density populations like San Francisco.
Well, it came to New York first. And I think that thinking that you're highly boosted is probably incorrect. I realize that New York City has fairly high vaccination rates, but the proportion of people who are boosted, which is what you need to have to stop transmission, is going to be relatively low. It's certainly not going to be up in the 80s or 90s. Here in San Francisco, where I am, 80% of the population is fully vaccinated, but we have stumbling blocks around delivering booster doses. There's just not enough personnel to do it at the pharmacies and stuff. So, that's going to be a rate limiting step.
Doctor, you talk about the availability of staff. This looks like, certainly from where I am, that this is going to be a very steep up in terms of the left-hand side of the spike that we're seeing, and a slightly less, but still relatively steep down.
Right.
As we kind of manage that process, is the healthcare system going to have the staff to be able to prevent those that are most severely affected sort of being able to be treated correctly? I'm already seeing impact on hospitals. Do we need to be giving doctors, nurses, healthcare professionals fourth doses right now so that they can look after everybody else?
There's no real data on that. It's an important idea to vet, but there are no data on fourth doses right now. Between personal protective equipment, PPE, and booster doses, I think we're in good shape. There's not going to be a lot of in-hospital transmission, but you need the people to take care of them. We have lots of room. It's just the number of people that we need to actually staff the hospitals. I think we're going to be, if this turns out to be not as severe, I think we may be close to okay. It may get to be real problematic though if it's more severe or if it's more widespread. If we get twice as many cases and they're half as severe, we're still going to be at the same place we are now.
100% on that front. When are we going to know if the narrative that it's less severe is true? And do we know anything yet about the Omicron variant and long COVID, even in those that are vaccinated and boosted?
We don't know anything about long COVID in terms of people who are vaccinated and boosted. The presumption would be that it would be much less common. So I think that's kind of good news. But I also think we need to keep our eyes really peeled about what the clinical course is going to be. Right now, the early data from South Africa, from the US, from Denmark, from the UK would suggest that hospitalization is not nearly as common as it was before. But if you have 10 times as many cases, it's going to push the hospitalizations. That's what Dr. Fauci was talking about yesterday.
Is this something we're going to have to get used to every Christmas? Mask mandates. Maybe it's not as severe, but do you think it's going to become more normal now, particularly in parts of the world where it gets cold and dark a little earlier, to just anticipate that we should be putting in place infrastructure, protocols that allow us to get through winters? How much of an impact is this going to have, do you think, on long-term behavior and advice from the medical community?
Potentially some. But, another scenario to paint is that we get 80% of the population infected this winter. And then people are walking around with some really high level immunity. And we may be blunting this going forward into the next years. I don't think anybody really wants to go that far out on a limb and predict what's going to happen next year. I mean, it's hard enough to predict what's going to happen next month.
Fair enough.
And you do it at your peril.